All right. Well, this is Rose Newman. I'd like to introduce Mr. Excel, who's our moderator tonight. Hello, Courtney.
Hi, Rose.
How are you tonight?
Good. How are you?
Great, thanks. I'd like to introduce our presenter tonight, Cindy Day Hauk. Cindy has extensive experience as a office manager for dental practices. Cindy is also a trainer, not only with Dentrix, but a dental writer, certified trainer. And Cindy has so much knowledge. We've seen you, Cindy, at so many seminars. I think in the last 2 years you've attended 6 or 8 at least. Pretty close. Okay, well, it's a pleasure to have you so much. Thank you for agreeing to do the webinar for us. Well, thank you. All right, so we'll go ahead and get started. All right. Well, welcome everybody, and I appreciate everybody coming to the meeting tonight. And first of all, I just want to talk a little bit about the topics. We're going to go over some front office basics. So before I do that, I would like to share a little bit, because you may not know my name or who I am or where I come from, but I do have a BSHA in health administration, and I've been in dentistry for about 30 years now, and I have clerical and clinical background as well. And I've also been a dental consultant since about 2001, and I have served as a Dentrix and Easy Dental certified trainer since 2000. I also instruct the workshops for those as well. And I was also served as a Henry Schein Field training manager, in which I had with over 15 states and 60 trainers. So I feel like I've got a lot of training background, but I just wanted to share with you some of the front office basics that I have gone through, and I want to share a little experience as well, because when I worked in an office that had dental writer, and my experience with that as well. So first of all, I want to go to the next slide. I want to talk about our little logo here, which is getting your ducks in a row, and that's actually what we want to do first. So front office basics is all about getting your ducks in a row. So if you already have dental writer, or maybe you're thinking about purchasing the software, you have to wonder about, well, where do I start? And how are we going to set up the protocol? And how are we going to decide what to file for? How do we reach the public about the practice and services? We have so many questions. So our time this evening is about learning about those basics of the front desk protocol. So as I said, I'm sharing my experience as well as when I worked in an office that used the dental writer and the process that we set in place with the help of the dental writer software. So as I said, where do we start? So one of the things that I want to discuss is this process wheel that you see of the basics that your front desk can prepare in preparing a phone call script to the new patient protocol, to the existing patient, to training your staff, and then we'll talk about financial arrangement, and to the implementation of treatment. Now, first of all, just so you know, we discussed a phone call script and what we're going to put in that script so that everybody's asking the same questions, because you want to make sure that your team is asking the right questions as well. You'll want to set up a script for anyone in your office that is answering the phone to discuss things like, do they have insurance? Are you working with sleep apnea appliances? If you are working with the sleep apnea appliances, you're going to need to know, do they have a referral from a physician? And also, do they have a sleep study as well? You'll also want to keep it as short as possible, because needless to say, nobody wants to stay on the phone for that long. But you might want to set it up, that script, as if it were a mini interview of sorts. So you want to gather as much information as possible to prepare not only your patient, but also to your staff. individual is different, and depending on the type of service you are offering, your script may vary in its content. So, whoever is answering that phone is the first impression of your office. And I like to think the patient is part of an experience, not just a dental appointment. And it starts with you. It starts with the front staff, and it continues throughout the time they spend in your office. I am totally sold on the experience of that visit that they come to your office for. So you want to make sure that everybody is feeling that same process, that it is part of an experience. It's not just an appointment that you show up for. Now, what type of service will you be providing? If you're going to offer sleep apnea appliances, there are some things to think about. So I'm going to kind of take some information from Courtney's great tips of the week that she posts. And you'll want to find out if the appliance you're using is FDA cleared for OSA or snoring only. And those oral appliances can be FDA cleared for treatment of obstructive sleep apnea. That's what the OSA is for, and snoring or snoring only. Now, it is important that you know that this, for the appliance you are using for your patients, because sometimes medical insurance companies will even ask you to provide clearance numbers for the device you are using when filing pre-auth and claims. You can perform a quick search on the FBI website. So the FDA provides a searchable 510K clearance database for medical devices or oral appliances for OSA. If you need the link for the search engine, you can find it on the Dental Writer website or the tip of the week that Courtney posts for us on Dental Writer's Facebook page. Or you can find it on, as I say, on the Dental Writer website. Now, let's say an example of one of those appliances might be a Somnodent. So you want to make sure it is a cleared appliance, whether it is for Somnodent Herbs or Classic or Flex and Somnodent G2. So when you search on that site, it's going to immediately display that device name, the applicant, the 510K number, and also that decision date as well. And there are a number of things to prepare for filing for that sleep apnea, such as deciding, now, do I want to be a Medicare provider? Do I want to be a DME provider? Are you going to offer a home sleep study to coincide with the patient's needs and physician's referral? So that has to do with the sleep apnea. Now, if you're going to offer services for TMD, you will want to, or the temporomandibular dysfunction, you will want to check to make sure you understand the protocol. It is for the proper filing for the ICD-9 diagnosis code. Now, Dental Writer provides those codes and will help in recommendations of what you will need to file to receive that reimbursement for the patient. And it has all of the codes that you're going to need. And, you know, there are many of those ICD-9 diagnosis codes for, such as jaw pain or facial pain or headaches. But there's only just a few of those ICD-9 diagnosis codes that will truly stand for a temporomandibular disorder. So you want to make sure that you are filing the correct codes, and that's where the software comes in. It really helps show you and kind of guide you where you need to go. The ICD codes also generally accompany the TMD diagnosis code on a medical insurance claim. And you're going to need to establish medical necessity for treatment unless a TMD diagnosis code is present on the claim as well. You know, such as headache alone does not establish that medical necessity for treatment. But a headache and a TMD does make it medically necessary for treatment. So those, the TMD ICD-9 codes are the 524 codes, and they provided in that Dental Writer software as well. So it's always important to check the medical policy as well for the TMDs when working with a new medical insurance. you can search the different medical insurance websites. You can check the Aetna website. You can check the Cigna website, the Blue Cross website, for the outlines of what services and treatments are covered. Now, if you are providing services for oral surgery or implants or perio, you'll also want to find out about what the medical insurances cover as well. You'll also want to research what documentation is needed for E&M billing, such as office visits, evaluation, and management. And if you don't know what that E&M stands for, it's evaluation and management. It is for office visits, exams, the DDS and DSD time with a patient. There are three different sets of codes to choose from when selecting the appropriate E&M code for your office visit with your patient. Such as with a new patient, they've got non-referred, and it is also have not presented for a medical visit within 3 years. Then the second one is for the established patients, and that's for patients seen within 3 years for a medical visit, and also follow-up. And then the third set is consultation codes, which are referred directly from another healthcare provider. So that requires follow-up letter to referring health professional, and some insurances no longer accept this group of codes, such as Medicare, and that's been since 2010. So let's talk about a little bit about the new patient protocol. Now, Dental Writer provides everything that you'll need for that new patient protocol. That new patient that was referred or maybe heard through maybe your advertising or word of mouth. And you will be able to enter the patient demographics, their insurance information, who were they referred by, and also provides those questionnaires in the software that you'll need to provide not only for your office, but for the insurance company and the referring physician. It will provide all the pertinent information and more to help you file for that reimbursement. It also provides the capability to email the questionnaires to your patients as well. So knowing that, now that we're in such a technology world stage here that everything is on the internet, we very much rely on the email process, our computers, our phones. Everything is digital now. And then our existing patient, and that existing patient is the patient that you already have in your practice. So let's say you may have the patient's demographics, their insurance information in your practice management system. Dental Writer bridges that information with your practice management system. Now, in the office that I worked in, we used Dentrix, and it integrated with Dental Writer to provide that demographic information, so we didn't have to enter it in twice. Now, the next thing that you'll want to do is you want to make sure that you're training your staff. So I want to just take you through the little process of what we did when we trained our staff and how we accomplished getting to the point where we could actually file through the Dental Writer software. The one thing that we chose to really focus on was the sleep appliances. As I say, you may want to focus on the perio or the TMD or another service, but we chose more to utilize the sleep appliances. The doctor that I did work for actually has sleep apnea, so he knew a gentleman, Dr. John Rimmers, and Dr. Rimmers actually patented the Rimmers home sleep study. Now there are so many different ones available, so there's so many out there, but we brought Dr. Rimmers in to teach us. We roped off a day. We took that time because we wanted to invest in our practice. So what we did was we had him come in, and he taught us about sleep study. He also taught us how to utilize our office for performing those home sleep studies and also appliance therapy how to get that best impression for those appliances that we need. And then once we went through that stage of setting up that script, that protocol that we needed for the new patients and its existing patients as well. We then had a dental writer trainer come in to train us on the software and utilize it for reimbursement. And we also learned how to file for other services as well. So if they had TMD or if they, accidents that happen and cause the TMD, we focused on that as well. But our main focus was mostly on the sleep. So once you've done that training, and the reason why we want to do that training is because we want to get everybody on the same page. That's probably one of the hardest things, is to get everybody on that same page. And I know that front and back, we all want to get everybody working together for the same thing. And we want to make sure that the patient has the best experience that they can have. So what we did was we practiced. We used role play. We practiced what to say, how to say it, and going through the complete patient experience from start to finish. Now, you may think, now when do we have the time to do that? Well, as far as we were concerned, if you want to make this venture a success, you will make the time. It is not only an investment for you, but also to your patient and their experience. Then that will also generate referrals as well. Now, how are we going to get that out there? We've got to promote our services. We've got to toot our own horn, so to speak. So you want to get out there and you want to talk to your patients. You may want to have some flyers out there on your front desk. You'll want to talk to physicians. You want to go make those relationships with those doctors. Now, we found some doctors that we knew really helped with sleep studies that they sent their patients to, and we made those relationships. And we not only referred to them, but they started referring to us as well. We also set up meetings with them. We took them to lunch. We let them know what our services were and what our intentions were with our patients. And we also wanted to ensure that we were going to send those patients back to them as well. And also, you want to keep in contact with those doctors too, because those doctors want to know what's going on with their patients that they just sent you. So the letters that are in Dental Writer as well, those are going to help you as well to keep contact with those referring physicians as well. That's very important to make those relationships. Now, one of the big things was we wanted to know how to promote ourselves. So some of the things that we did at the time was we did some radio advertising. And it depends on your area what works best for you, because you may want to do some little spots on the radio and do it at particular times where you know that your patients are going to be listening to the radio. Also, you may want to do some TV advertising, some television advertising, little spots here and there. We did several spots on TV, and also we really relied on that word of mouth, from our other patients, and also those referring physicians that we had as well that would refer their patients to us. And then those patients that came to us, they're happy with that experience. They're going to go talk to their friends, their family, and also let them know what service we have. Also made flyers as well. So as I said, I had flyers on my front desk. And I also mailed some of those flyers. So we had different mailers that we would send out. And also now we have social media. We've got Twitter, we've got Facebook, you name it. We've got the great wide web now. So you can go put yourself out there on that web and advertise on the website. Most people now, they wouldn't look in a phone book for you because you ask somebody maybe 18, 20, 30, they may not even know what a phone book is now. Everything is generated off of that internet. So figure out how you want to promote yourself in a tasteful manner, and also you'll know that Dental Writer has its own advertising as well. If you're thinking about maybe going into the sleep apnea appliances, there's snoring is sexy now, so that's something that is a great advertising for yourself as well. To be one of those providers that provides the snoring is sexy. And if you have questions about that, you can always contact Dental Writer, and they will let you know all about that. Okay, and then also we wanted to not only go through the script and what we were going to do with our patients and what service and how we're going to promote, but we also needed to figure out about our financial arrangements. One of the things that we chose was we were going to file medical insurance for our patients, but we also did fee for service. So in other words, they paid for the appliance and then they were reimbursed from their medical insurance. So it's entirely up to what your office chooses to do. And if you want to file that medical insurance for them or show them how, whatever it is that you choose to do. But through the Dental Writer software, it makes it so easy for you all, because Rose Neerman and her staff have just thought of everything to put into this software to help you with that reimbursement process. You can also set up protocol for gathering the insurance coverage information as well. So what insurance coverage information do I need? As I said, you can go to those different websites. You can go to the Aetna website. You can go to the Cigna website. You can go to any insurance website and find out what do they cover. You'll also maybe want to set up some payment arrangements, maybe buy a credit or a debit card or a health card. That third-party financial institution you could set up with as well, so that they could pay that financial institution, and they could pay payments with them, but you would get reimbursed from the financial institution for that. And then also, you may want to discuss about financial arrangement forms. And how are we going to get those financial arrangement forms? Well, you can make up your own or look into the Dental Writer software, because the first option that we have for financial arrangements there are sample financial consent word templates found in any patient chart in Dental Writer on the Quick Letters tab. So you can generate the financial consent that will bring in the patient's information, their name, etc., or for each patient by simply generating that quick letter within the patient's chart. So I've got a picture here that kind of shows you that first option, and you'll see it's coming from that Dental Writer here, and it's under the Quick Letters tab there. And you'll notice it has the red arrow is pointing to the search quick letters, and it has a list there of the different types of quick letters there for you. So they've provided all that information there for you, just at your fingertips. Is awesome. The second option, also you'll use the same tab of the Quick Letter tab, and you can customize your own financial consent form right into Quick Letters. And once you've done that, it's available in any patient chart to use. Now, you can even insert your own merge fields. So the data like patient name or their address or provider name, the NPI number, etc., would all pre-populate right into the letter when it's generated. So here's a picture of that second option as well, to where you can customize your own quick letters into the Dental Writer software. As you see, it has the little red arrow there from Customize, to where you can go right in and just type in. If you want to change something on that letter and just add into it, you can customize it right there. Now, once you've set up those financial arrangements, now you're ready to implement that treatment. So deciding on what it is that you are going to, what treatments you're going to perform. It's now time to file the insurance And when you file that insurance, then you can utilize the dental writer software, which makes your job easier. You know, in the beginning, when we first started, I did this by hand, and it took me forever. Because for one, you have to make up your own letters. You have to go in, and you've got to write out on the claim forms. It was a nightmare. And the doctor that I worked for went to a seminar with Rose and met her and bought the software, and oh my goodness, what a difference it made in having to do that by hand versus having Rose do that for you. I mean, literally, she's just thought of everything there is. And then from that time, once you have filed that medical insurance, now all you have to do is you just have to begin. You just have to get started. When you are filing, just so you know that right in the software, it already has the CMS 1500 medical form. So after you have performed the treatment, you'll want to use that CMS 1500 medical form, and it's included right in the software. Now, my experience with working with this in the dental office, it was invaluable. As I say, we had that trainer that came to our office and taught us how, and not only did we have the trainer come in, but we had phone support as well when we needed help, or maybe just some guidance in how to deal with the insurance companies and the proper coding to receive reimbursement. You have a number of people there at Dental Writer that will answer any question that you have about how to file or what code you need to use and how to get this process started. So we really, really appreciate everything that is in the software that's for your convenience and also to help the experience for your patient as well. So that's the information that I've got, and I know it was maybe some things that you knew already, but I just wanted to kind of give you our experience of what we went through. And I'm going to ask Courtney or Rose if they want to come on, and if anybody has questions to help me out there.
Great. Thank you so much, Cindy. That was such an awesome presentation. For everybody on the line, if we're going to go ahead and unmute your line now, if you have any questions for Cindy. If you don't want to be muted, feel free to just mute yourself right back. And you can also feel free to use the chat box in the lower right-hand corner of your screen. All right, so I don't see any questions in the chat box. Anybody feel free to jump on the line if you have any questions or comments, or if you had a similar experience or anything you'd like to share with Cindy.
Cindy? Yes, I just want to say you did an excellent job, and as you were going through this, I was talking to myself as you were talking, and I'm like, this is perfect, because I'm shadowing exactly what you were saying. And we pretty much have done everything the exact same way you did. You did a great job presenting that today. Thank you. Thank you. You're welcome.
Agreed. You know, I've got a great question down here in the chat box from Crystal. And the question is, where is the best place to get the E as an elephant codes from? That's an excellent question. The E codes, if you're actually looking them up in the book that they're printed in, the book is called the HCPCS book, and that's spelled HCPCS, and that's where you'll find your durable medical equipment, orthotics, and supply codes. Also, in the Dental Writer software, if you're billing out for oral appliances for sleep apnea or something along those lines, those codes will be built into your exam forms, as well as built into your crosscode software, so you can go ahead and search them in there as well. Great questions. All right, any other questions or comments for Cindy? Okay, great. Well, again, thank you so much, Cindy, again. As Megan mentioned, that was just a great presentation, and we really enjoyed having you, and we learned a lot.
Thank you so much.
Thanks. And now I hope everybody will join us next week. We're doing a session over Medical Documentation 101 next Tuesday at 8 Central. We also have some great special guests in the pipeline. We just had Dr. Steve Lamberg last week, but we'll have some more special guests in the pipeline for you. So hope to see you all next week and in the coming weeks. Oh, yes, and Happy Canada Day. July 1st is Happy Canada Day.
Thank you, Rob. Thank you.
All right, thanks everybody, and have a great night.
Thank you. Thank you, everyone. We hope to see this seminar soon.
Absolutely. Good night.